Hello, my name is Abina Javier. I've been with Dedicated Care since 2019 July. I'm a licensed social worker, and I have with me
Maruf Kamara, the housing liaison, and I've been with Dedicated Care for the same amount of time.
Okay, so me being a therapist, Maruf being a housing liaison and a community support worker, we share a lot of clients together. Today we are going to talk about client X. You know,
yes,
the person,
this client
right?
X, Abina and I myself have worked with this client for a couple of months now, and we've been hanging heads to see what we can do for this client.
And I think what brought the client in was substance abuse issues, and I really like the way Maruf went the extra mile to, you know, involve the health provider, the nurse, to make sure that he's on his medication. But then later on we realized he was using and he couldn't, you know, medication and the drugs wasn't working.
Yeah.
So how did you get him enrolled in
this client, like you said, when we encountered this client, it was massively damaged as a result of substance use.
Mm-hmm.
What we did initially was to explore the various drug programs that we have in DC and to have him and to have his intake done. So we worked amicably to get him into a treatment program, and once he get into the program, it was a 28 days program, and he was referred to another program. And since then, we started working on his sobriety, and things start to get better. Yeah.
And we are happy to say now he's sober. He needs constant monitoring, but as we are speaking, Maruf has his prescription. Yeah. He's going to make sure he gets his medication so that, you know, it helps him manage his symptoms versus using street drugs. So
yeah, he's one of those clients that you have to manage quite well because
keep an eye.
Yeah, because when it comes to prescriptions, you would want your client to have a fast refill of his drugs. So what we did, we tried to get his medication to him and force him to get to the respective CVS where he collects his medicine.
Yeah. And you know, depending on the severity of the client's issues and the special needs they have, we keep an eye on when they are running out of medication. Have they missed any provider appointment? Can we reschedule and ensure that, you know, they are receiving services smoothly?
On a scale from 1 to 10, his sobriety level could be rated as 7 for now. We don't know what the future will, but we are trying to get him on course to sobriety.
So this is just an example of what we do for our clients. We always go further than the extra mile for them, and depending on their needs, we specialize, you know, our attention and our care. It's never a cookie cutter approach. So yeah, that's what we have for today.
So Dedicated Care has gone from strength to strength. From where we took Dedicated up to this level, we have massively improved the care level.
And we can only go higher, right? Yes. Put it down, Maru.
So I'm Janet Reinhardt, and I'm a part of Team Leader 1. And a little bit about what I do is I manage a team of CSWs who work with clients that are part of our core service agency. And the one thing that I love about working with Dedicated is that the team really cares and we are really connected. And a big part of what we do in the community is help people to get connected with services, and we help them to just be better than who they are or where they are.
Hi, my name is Petra. I work with Dedicated Care Health Services. I'm a community support worker. I help the clients with resources in the community. So like if they don't have like ID card, food, they don't have income, jobs, we help them with all those stuff. So I help them with job application, providing them with resume if they need one. And we also help them connect them to other services around the community. Thank you.
Yeah, my name is Miriam Mege. I'm the community nurse for Dedicated Care. I have a very big role to play because I have to coordinate with these two beautiful ladies right here to make sure the clients go to their appointments, to make sure that they take their medications, to make sure that they go to their appointments on time, and then they have to come to see our providers to take their medication and be good. So First of all, most of the clients that we meet have not seen the primary care for like 10 years, 5 years, 6 years. It sounds unreal, but that's what's going on. So we have to reconnect them to their PCP, and then we have to make sure they go follow up with their health to maintain it and to promote it. So that's what I do.
And I'm Helen Konglak. I'm team lead for team 3, and I'm also a community support worker. So as a team lead, I approve notes so these ladies can get paid, so everyone can get paid. And also, while approving notes, we look out for consumers who have, say for example, medical issues, emergencies, and report to a field nurse or to the provider, and also provide services to available in the community to these consumers.
My name is Miss Mary Around. I'm the clinical assessment person in Dedicated. All clinical assessments pass through me. So when you're linked to Dedicated, you see me first, because without my assessment, you cannot receive any services. And I'm very happy to be part of Dedicated, and I know that the work that I do impacts the clients, because I take all the information before they could even see the doctor. They have to pass through me, and they know that they might not be happy with the questions that I'm asking them, but they know it's important, because the government does not give you anything for granted. So assessments are very important. You have to do your assessment before you can get services. I just want to let the clients know that it's not Miss Mary, it's just the rule that you go to the hospital, you give your information, they do every assessment on you, then you can proceed to having medications or the services we provide. It's a good thing to be part of this hard-working team and a company that grows and motivates their workers.
And now we're about to go do some more interviews.
Thomas Tanu is my name. I'm currently the promoter, founder, as well as the CEO and president of Dedicated Care Health Services. Dedicated Care Health Services initially started in Virginia, and in Virginia we provide services to people with developmental disabilities, both in residential adults, in particular in a residential group home setting, and later on we got licensed to provide services in the in-home support setting, meaning people live with their parents or in their own apartments and also have to go work over there. Down the line, we also noticed that there was a huge need to support consumers and clients and persons who are suffering from mental challenges and substance use disorders. That being the fact, we accordingly got incorporated in DC in the later part of 2017 as a mental health rehabilitation service agency, or a core service agency. And as of today, we have 2 locations out here at the Providence Hospital. We just signed up another lease at 1410 Good Hope Road in Southeast DC, where about 60% of our consumers are resident. And essentially that's what it is. Ours is to work hand in hand with the Department of Behavioral Health, other agencies, as well as other stakeholders in DC to support consumers, their families and relatives, and see how we could provide resilience and treatment to their mental health challenges.
Hello, my name is John Takem, and I'm Program Director for Dedicated Care Health Services. Dedicated Care Health Services is a mental health program. It runs the mental health community clinic in Washington, D.C. And Dedicated Health also runs a mental health group home program. I'll talk a little bit about the community mental health clinic. So we provide mental health services to adult consumers in the District of Columbia. We'll provide services like medication management, we'll provide psychotherapy, we'll provide community support services, We have been operating in the Washington, D.C. area for the past almost 4 years now. We actively started operations in 2018 and we've been waxing strong. We have a solid team of mental health specialists. We have board certified psychiatrists. We have experienced APRNs, psych nurse practitioners. We have certified licensed independent clinical social workers, provide a range of services including diagnostic assessments. They provide psychotherapy, and they supervise community support workers who are the bedrock of the recovery processes of our consumers in the district. We also have site nurse, registered nurses who provide a whole range of psychiatric nurse services to our consumers. One of the services that we do provide, which we are making great strides in, includes linking consumers to housing services. It is a well-known fact that in the District of Columbia, housing is a major crisis. A lot of our consumers that we serve are homeless. They reside in shelters, and within the recent past, the District of Columbia government is making a great stride in providing housing services. They are tearing down some, encampments in the city, and so we are a big part of helping consumers who are homeless to be able to have a stable life again.
My name is Joy Ellis George. I'm the Vice President of Operations here at Dedicated Care Health Services. I'm also a nurse practitioner by training. Dedicated Care is located on the grounds of Providence Hospital in Suite 216 and 215. Today we held our first annual in-person staff meeting. We are over 60 staff members strong, and we provide care for 1,000 plus clients in the District of Columbia. We're a core service agency. To be referred to our agency, you would need to call the Access Helpline so that we can provide services for you. We provide anything from medication management, psychotherapy, community support DC residents with applying for benefits, and medical care coordination. We have a community health nurse who goes out into the field, does assessments, and coordinates care with the medical providers. If you would like to see us, go to www.dedicatedcaresupports.com and make contact with our staff at 202-525-1715. My name is Joy Ellis George. I'm the VP of Dedicated Care Health Services. Keep watching TANTV. Thank you.
My name is Thomas Stanway, CEO of Dedicated Care Health Services. Keep on watching TANTV. Thank you.
Thank you for watching TANTV. Please subscribe to our YouTube channel, the link below.